Acepental Safe and Effective Use Guide. Acepental is a non-steroidal anti-inflammatory drug NSAID containing the active ingredient Aceclofenac. It's used to manage pain and inflammation associated with conditions like 1. Introduction to Acepental. Acepental is a non-steroidal anti-inflammatory drug NSAID containing the active ingredient Aceclofenac. It's used to manage pain and inflammation associated with conditions like rheumatoid arthritis, Ankylosing spondylitis, Osteoarthritis, back pain, toothache. 1. Introduction to Acepental post-surgical pain. 2. Composition and presentation. Composition. Aceclofenac. Presentation: tablets. 3. Contraindications. History of allergy or hypersensitivity to Aceclofenac. Individuals with known allergic reactions to Aceclofenac or other NSAIDs should avoid Acepental. 3. Contraindications. History of asthma, nasal polyps, or acute rash following aspirin or NSAID use. These individuals have a higher risk of severe allergic reactions to Acepental. Severe heart failure. Using Acepental can increase the risk of heart failure in patients with severe heart failure. 3. Contraindications. Severe liver disease. Patients with severe liver disease may experience serious side effects from Acepental. Severe kidney disease. Acepental can increase the risk of kidney failure in patients with severe kidney disease. 3. Contraindications. Active peptic ulcer disease or history of gastrointestinal bleeding. Individuals with a history of peptic ulcers or gastrointestinal bleeding should avoid Acepental as it can increase the risk of gastrointestinal bleeding. 3. Contraindications. Pregnancy and lactation. Acepental is not recommended for pregnant or breastfeeding women as there is insufficient data on its safety for the fetus and infant. Children. Insufficient data exists on the safety and efficacy of Acepental in children, so it shouldn't be used in this population. 4. Dosage and administration. Adults 1 Acepental tablet equivalent to 100 mg Aceclofenac twice daily. Children. Acepental should not be used as there is no clinical data on using Aceclofenac in children. 4. Dosage and administration. Elderly. The pharmacokinetic profile of Aceclofenac does not change in elderly patients, therefore, dose adjustments are not typically required. Important notes. Use the recommended dosage. Strictly adhere to the prescribed dosage and frequency of Acepental. Do not adjust the dosage or frequency without consulting your doctor. Take with water. Do not crush, break, or chew Acepental tablets. Important notes. Avoid expired medications. Always check the expiry date on the packaging before using the medication. Common side effects: nausea, vomiting, diarrhea, constipation, abdominal pain, bloating, dizziness, headache, fatigue. Serious side effects: gastrointestinal bleeding, peptic ulcer disease, kidney failure, liver failure, severe allergic reactions. 6. Drug interactions. Anticoagulants. Using Acepental with anticoagulants can increase the risk of bleeding. Diuretics. Using Acepental with diuretics can reduce the effectiveness of diuretics. Antibiotics. Using Acepental with certain antibiotics can reduce the efficacy of the antibiotics. 7. Precautions. Use with caution in patients with a history of liver disease, kidney disease, cardiovascular disease, asthma, peptic ulcer disease, or gastrointestinal bleeding. Avoid Acepental in pregnant and breastfeeding women. Monitor patients closely, especially those at higher risk for side effects. 7. Precautions. Report any side effects experienced while using Acepental to your doctor. 8. Storage. Store Acepental in a dry, cool place below 30 C. Protect it from direct sunlight. Keep it out of the reach of children. 9. Additional information. Consult your doctor or pharmacist before using Acepental. Always read the package insert before using the medication. Do not stop using the medication without consulting your doctor. Store the medication carefully according to the instructions. 9. Additional information. Note: this is general information about Acepental. For specific information, always consult your doctor or pharmacist.